You know, every once in a while, a topic comes up regarding our kids' health that is just, it's awkward to talk about, but it's really very, very important that we do. So let's put the awkwardness aside for a second with Dr. Marvelyn DeCambry from Children's Physicians Medical Group. Nice to have you here this morning.
Thank you.
We're talking about something that affects young boys this morning.
Right.
And again, I think everybody titters and giggles a little bit when you say the word testicular torsion.
Right.
Okay, well now let's all get over it because this is a very serious condition for young kids.
It's pretty important. About 1 a week occurs at Children's Hospital. So about 52 kids a year suffer from this particular problem. And testicular torsion is when the testicle, which hangs on its blood supply, twists along that axis. And it twists within the scrotal sac, and the child can suffer from the testicle dying because the blood supply isn't getting to it.
So first, it could be very painful as well, could it not? I mean, a child would complain about extreme pain in the scrotum.
They will experience pain, but they may not complain about pain, and that's really the reason why I'm here today, is that a lot of boys tend to avoid telling their parents that this is happening.
Okay. Well, sure, because they're probably a little embarrassed.
Right, right.
And they don't know what it is, like
Exactly.
so many other changes that kids' bodies go through.
Right, and boys go through changes just like girls do, but there is not a big forum for them, so they tend to keep that information to themselves, unfortunately, until it's too late. It's usually when the boys have a swollen testicle that they start to mention it to their parents, and then it's often too late. And there's a real short window to get kids into the emergency room and get them get the problem corrected.
It's just a matter of hours, is it not?
6 hours.
Wow. Okay, so at what age does this normally affect kids?
It occurs in two distributions, right around birth, and then again around 12 to 18. 65% of patients who have testicular torsion, it'll occur between 12 and 18 years of age.
Okay, so most of them are a little bit older that can communicate that they've got some kind of a problem.
Yes, but they still don't.
How do you know, though, if it's an infant? How would you recognize that as a parent?
It's swollen.
Okay.
The area is swollen and it's discolored, and if they're Caucasian, it'll look blue.
Okay, so at that point, is it too late to do anything?
Oftentimes for the perinatal time, it's too late. But it's important to secure the other testicle, because if you lose both testicles, then it's devastating.
Sure. Now we're talking about the child's ability to have children in the future themselves.
And go through puberty. So testicle is also important for testosterone production and sperm production. So if you aren't able to have that organ to facilitate both testosterone production and sperm production, then it's a problem.
Okay, so you're not getting the hormones that you need just for normal development at that point.
Right.
And then down the line, maybe not being able to have children.
Exactly.
As well. Okay, so as a parent, I guess, what do I tell my kids?
You want to tell them that if they have pain, that they need to tell you, and that they shouldn't be embarrassed about it. And usually if boys know that their body is an important thing to describe to their parents,
sure,
then they'll facilitate that.
Now, again, do we know exactly what causes this? Because I was trying to read up on this and study, and there was even some mention of getting out of a warm bed into a cold room, and that could cause a quick contraction and a twisting.
Right.
Is that just one of the things?
There are a lot of different things that people think are associated with testicular torsion, but the thing that we believe is the most fundamental part is that the testicle isn't secured to the inside of the scrotum. And so if children were born with an undescended testis or a hydrocele, they may not actually have the testicle secured to the bottom of their scrotum. Trauma certainly can get the testicle to move up, because it's kind of like a chandelier. It sort of hangs on this cord. So if it twists around its blood supply within that space, then that's a problem. We, as surgeons, we go in and we anchor it so that it can go back and forth, but it doesn't twist along its axis.
Dr. Marvelyn DeCambry, that's really interesting, and again, something that parents wouldn't normally think to talk about to their kids, but certainly something they should be aware of.
Thanks for giving us the opportunity to talk about it.
Thanks for coming in. Always Children's Physicians Medical Group. We love them.
Thank you.
Take good care of our kids. Thanks. All right, for more information, you go to san diego6.com, just click on Hot Topics.